Today's medical-centric topic is myths and facts about whooping cough in adults. Whooping cough, or pertussis, is often thought of as a childhood illness, but adults can also contract it. Misunderstandings about this highly contagious respiratory disease can lead to delayed diagnosis and treatment. Let's debunk common myths about whooping cough in adults and reveal the facts. 1. Myth: whooping cough only affects children. Fact: while whooping cough is more common in children, adults are susceptible, especially if their immunity has waned. Vaccines provide protection but may lose effectiveness over time, requiring booster doses. 2. Myth: adults with whooping cough always experience a whooping sound. Fact: the classic whooping sound is more common in children. Adults may have a persistent hacking cough without the distinctive sound, making diagnosis more difficult. 3. Myth: once vaccinated, you're immune for life. Fact: immunity from vaccines or previous infections fades over time. Adults should get a Tdap booster every 10 years to maintain protection against pertussis. 4. Myth: whooping cough isn't contagious in adults. Fact: whooping cough is highly contagious, even in adults. It spreads through respiratory droplets when an infected person coughs or sneezes. 5. Myth: whooping cough is just a persistent cough. Fact: pertussis is a severe illness with distinct stages. Catarrhal stage: mild symptoms like runny nose, low fever, and mild cough. Paroxysmal stage: intense, prolonged coughing fits lasting several weeks. Convalescent stage: gradual recovery, though the cough may persist for months. 6. Myth: antibiotics aren't necessary for adults. Fact: while antibiotics won't cure whooping cough once it's advanced, they can reduce the infectious period and prevent spread to others if taken early. 7. Myth: healthy adults don't need to worry about whooping cough. Fact: whooping cough can lead to complications like rib fractures from intense coughing, pneumonia, or even fainting. It's especially dangerous for infants exposed to infected adults. 8. Myth: it's easy to identify whooping cough in adults. Fact: symptoms in adults are often mistaken for bronchitis, asthma, or a lingering cold, leading to delayed diagnosis. Prevention tips for adults: stay vaccinated. Ensure your Tdap booster is up to date. Avoid contact with infected individuals. Minimize exposure to people showing symptoms of pertussis. Practice good hygiene. Wash hands frequently and cover your mouth when coughing or sneezing.
Thank you for watching our video. Please do not forget to like and share the video. Also, please subscribe to the channel to stay updated on our latest videos.